In surface marking, it is marking the structures which are deep on the body, on the surface of the body. There are two types of landmarks in surface marking. One is the bony landmarks, which are visible landmarks. In some of the muscular and obese individuals, the same landmarks can be palpable landmark. So in this example, I am telling you how to mark surface marking of the axillary artery. First we have to take the mid-clavicular point. So that is done by palpating the clavicle. Medial end will be the most prominent. Then going across a sinus curve, palpating the clavicle throughout and reaching the top of the shoulder. That is the acromial end of the clavicle. Measure the sternal end to acromial end, medial to lateral end. Approximately, if it is 15 centimeters, the midpoint will be 7.5 centimeters. Take that midpoint of the clavicle. That is the first point. Second point is midpoint on the lateral wall of axilla. So how to get this midpoint on the lateral wall of axilla? When we press upon our hip from our hand, the anterior axillary fold and posterior axillary fold becomes prominent. When there are these two folds are prominent, measure from the anterior axillary fold to the posterior axillary fold. If it is approximately 5 centimeters, take the midpoint. That will become 2.5 centimeters midway between anterior and posterior axillary fold. So that is mid axillary point in the lateral wall of axilla. So this is the second point. Now join these 2 points, that is a mid clavicular point to the mid axillary point, by curvilinear line with the convexity directed superiorly and laterally. So that is how we have to draw, and that gives us axillary artery. With the same markings, that is the mid clavicular and mid axillary point, just within the axillary artery, if you draw parallelly one more tube, one more line in blue color chalk piece, then it will become axillary vein. This axillary artery is a continuation of subclavian artery beyond the outer border of first rib. The axillary artery is divided into 3 parts by the pectoralis minor. The first part is proximal to pectoralis minor. The second part is deep to pectoralis minor, and the third part is distal to the or lateral to pectoralis minor. The first part gives one artery which runs towards the pectoral region from the upper part of the thorax, so it's called superior thoracic artery. The second part of the axillary artery gives 2 branches. One supplies the lateral thoracic wall, so it's called lateral thoracic artery. The other supplies the thorax as well as the acromial area or the deltoid area, so it's called the thoracoacromial artery. These are the 2 branches of the second part of axillary artery, that is lateral thoracic and thoracoacromial. Whereas the third part, that is the last part, gives 2 arteries which winds around the neck of the humerus from front and behind. It is called anterior circumflex and posterior circumflex humeral artery. Circumflex means across the circumference. Circumflex means across the circumference. Anterior and posterior circumflex humeral artery. One more artery goes to the scapula from the undersurface of scapula. It is the largest branch of axillary artery. It's called subscapular artery. It enters the scapular region by passing through the lateral aspect or the lateral border of the scapula to supply the scapular muscles. It also gives circumflex scapular vessels which passes across the lower triangular space of scapula to supply the scapular region. So this is in detail about the axillary artery. The axillary artery ends the lower border of teres major by becoming brachial artery. Artery can undergo atherosclerosis, that is deposition of lipid in the tunica intima of the blood vessel, resulting in thickening or narrowing of the lumen. Weakness of the vessel wall can result in abnormal dilatation, irreversible dilatation of vessel wall. It's called aneurysm. Then there is a possible rupture of the axillary artery. So this is in detail about the surface marking, the origin, termination, branches of axillary artery in depth. Thank you for watching and learning from Raj Moliko.